Hi, I'm John Burrows, President and CEO of the Burrows Healthcare Consulting Network, and I'd like to talk to you briefly about how to manage professional conduct issues. On every medical staff, there's a small number of people who make up the vast majority of conduct problems and challenges. And it's important to have a standardized approach that works to help them to improve and to frankly protect the medical staff in the hospital from adverse patient outcomes. So I would like to give you 5 steps to consider. Number 1, discuss and negotiate professional conduct issues and their potential impact on patient safety and collegiality. Many people already know this, but the Joint Commission discovered years ago that poor communication makes up the majority of all adverse outcomes or sentinel events in hospitals today. That means it's critically important that we all act in a mutually respectful way at all times. It's important for the medical staff to have that discussion. Number 2, develop a policy and procedure around professional conduct issues. Why should the medical staff address this on their own through a medical staff policy and procedure? Because if you don't, and per federal law, you'll default to the hospital's policy and procedure, which is probably not something most physicians want to do. Number 3, discuss, negotiate, and develop performance metrics and targets around professional conduct. If you don't measure it, you can't manage it. And it's critically important that the medical staff create performance metrics around behavior. This might be number of validated incidents and have targets of 1 is a good score, 3 is not so good, etc. But if you don't provide feedback to physicians around objective performance, you can never manage it. Number 4, provide the feedback and, more importantly, create measurable improvement plans for individuals who struggle with these issues. It's no good to measure data and not provide the feedback, and more importantly, help a physician to be successful by giving them an improvement plan that's negotiated and is successful at improving performance in a measurable way. And finally, number 5, manage poor performance if necessary and take corrective action as a last resort. Obviously, if someone won't accept your help or can't accept your help, you're still going to have to take steps to restrict disruptive behavior that can have an adverse impact. The key is to raise the professional bar, create a standardized approach, and take on the approach that by helping people with their professional conduct, it helps physicians to reach their potential and helps prevent inadvertent errors that can cause harm to patients.